providing privacy. Gonna wash my hands. I cleaned my stethoscope prior to entering and introduced myself. Hello, my name is Dr. Calderon. How are you?
Hello, I'm fine.
Okay. What is your name?
My name is Dr. Ruthenberg.
Hi, Dr. Ruthenberg. Any symptoms you're experiencing today?
No.
And we are here to do your musculoskeletal, peripheral vascular, and neurological assessments. Can I start by asking you a couple silly questions?
Sure.
What is your name again?
My name is Sharon Ruthenberg.
And where are you?
I'm at the School of Nursing lab
And why are you here?
for an assessment.
And what time is it?
It's about 4:30.
Perfect. And I'm going to ask you another few questions. How old are you?
59.
And what gender do you identify as?
Female.
I have a 59-year-old female who appears her stated age and gender. She is sitting upright on the side of the bed with an erect posture. Her speech is clear and articulate. Her facial expression is neutral. Her dress is appropriate to the situation in scrubs. She's clean and hygienic. She is symmetrical with no overt physical deformities. We're going to start by assessing cranial nerve 3, the ocular motor nerve, starting by looking at your pupils, which are equal and round and approximately 3 millimeters in size. We're going to close the light and attest for reactivity. Opening my pen light, looking to see that the left eye constricts, and bilaterally, both eyes constrict. Looking to see that the right pupil constricts, and then bilaterally, looking to see that they both constrict. Going to turn the light back on. And then we're going to test for accommodation. So I'm going to have you look at the very far pole and then follow my pen light back in. Pupils constrict and eye muscles converge. So altogether, pupils are equal, round, reactive to light, and accommodate. Going to test cranial nerve 7, which is the facial nerve, by having you make a couple silly faces. I'm going to have you smile and frown and puff out your cheeks and lift your eyebrows. This indicates that cranial nerve 7 is intact. Going to move on to the spine. I'll have you standing. And I'm looking at your spine. The color of your spine is pink tan with scattered macules and papules that I can see and visualize. We're going to assess the contour of your spine, starting with the cervical, which is concave, the thoracic, which is convex, the lumbar, which is concave, and the sacral, which is convex. I'm going to palpate your spine. Please let me know if you're having any pain or tenderness.
No.
Any pain or tenderness?
No.
Pain or tenderness? No lumps or masses are felt. Patient denies any pain or tenderness. Patient is warm to the touch. Now I'm going to have you do some active range of motion, starting with having you pull your chin to your chest and upwards, and then rotate from side to side, left and right. And then you're gonna pull your ear towards your shoulder, and then your other ear towards your other shoulder. Patient has active range of motion of her cervical spine. Moving towards your lumbar spine, we're gonna have you bend towards your toes, and then upward. And then I'm going to have you rotate from side to side, left and right. Good, and I'm gonna have you laterally bend from side to side. Excellent. Patient has active range of motion of her lumbar spine, and then I'm gonna have you take a couple steps forward towards, yep. Assessing for your gait, which appears to be as balanced as possible without any shoes.
Yeah.
And any difficulty with taking any steps?
Nope.
Excellent. You can have a seat now. I'm gonna move towards your shoulders, looking at your shoulder color, which is pink and tan with scattered lesions noted throughout. She is symmetrical and no overt swelling is apparent. Any pain or tenderness?
Nope.
Pain or tenderness, pain or tenderness. No lumps or masses are felt. Patient denies any pain or tenderness. I'm going to have you lift your arms, do it assessing for active range of motion in your shoulders. So move up your arms and down. Perfect. And then move out your arms, abduction out, and then adduction in. Perfect. And then we're going to test cranial nerve 11, which is the spinal accessory nerve. I'm going to have you shrug your shoulders and down, and we're going to do that against resistance. Up and then down. Patient has 5 out of 5 muscle strength in her shoulders, indicating that cranial nerve 11 spinal accessory is intact. Moving down to the upper extremities, upon visual inspection, color is pink and tan with scattered macules and papules with no other lesions visualized. She is symmetrical bilaterally with no overt swelling noted. We're going to assess the brachial, or no, I'm going to palpate, looking at any pain or tenderness.
Nope.
Please let me know. Pain or tenderness, pain or tenderness, pain or tenderness, pain or tenderness. Patient denies any pain or tenderness. No lumps or masses are felt. She is warm to the touch. Going to start then palpate her pulses, starting with the brachial nerve, or brachial pulse, which is 2+ bilaterally, moving down to the radial pulse, which again is 2+ bilaterally, and assessing for capillary refill, which is brisk and occurs in less than 2 seconds bilaterally. I'm going to have you now sit. I'm going to have you do your elbow, or test your active range of motion of your upper extremities, starting with your elbows. So flex your arms in, and then extend outward, and then pronate, and then supinate, pronate, pronate, and then supinate. Good. Pronate and supinate. Excellent. And then we are going to have you lift your arms upward and pull me, and then push me away. Excellent. Patient has 5 out of 5 muscle strength in her arms. Moving down towards her wrist, I'm going to have you flex, and then extend, and then flex, and then extend, and then I'm going to have you do this against resistance, so push down, and then push up. Excellent. Patient has 5 out of 5 muscle strength. And then we're going to end with your wrist. Opening and or your fingers, opening and closing, opening and closing. Excellent. And then we're going to test your muscle strength by having you pull against me. Excellent. Patient has 5 out of 5 muscle strength in her upper extremities. Now I'm going to have you lay down. Starting off with the visual inspection of your lower extremities. Patient appears to be pink and tan with scattered lesions noted throughout, macules and papules. A large scar is noted on the patient's left shin, and visible veins are noted. She is symmetrical bilaterally, and no swelling is apparent. Any pain or tenderness that you're experiencing? Pain or tenderness?
Nope.
Pain or tenderness?
Nope.
Pain or tenderness? Pain or tenderness?
Nope.
Pain or tenderness? Patient denies any pain or tenderness. No lumps or masses are felt. Patient is very warm to the touch. Going to assess for edema. Looking at this aspect of your bilateral, and 0 edema is noted bilaterally. we're gonna move towards assessing the pulses, starting with the posterior tibial pulse, which is 2 plus bilaterally, moving towards the dorsalis pedis pulse, which is 2 plus bilaterally, and assessing for capillary refill, which occurs in less than 2 seconds and is brisk. We're going to do active range of motion of your lower extremities. We're going to start by having you bend your knee in and bend out, bend in and bend out. That is testing for active range of motion of the hip and knee together. We're going to have you lift one leg outward and inward, which is abduction and adduction respectively, and your other leg abduction and adduction respectively. We're going to do this against resistance. So flex your leg in, excellent, and then switch and flex outward, excellent. We're going to do the same thing on this leg, flex in, excellent, and then flex out, excellent. So patient has 5 out of 5 muscle strength in her hip and knee. Going to test the ankles now by having you lift your toes upwards and then push down on the pedals, excellent. And do that one more time for me, flex and extend, excellent. And I'm going to have you put your palmar surface of your toes together, the soles of your feet, excellent, for inversion, and then eversion, and put your knees together and flex outward. Excellent. Let's do that one more time. Inward for eversion, and then, or inversion and then eversion outward. Now we're gonna do this against, we're gonna test muscle strength. I'm gonna have you pull up towards me and push down towards the gas pedal. Excellent. Patient has 5 out of 5 muscle strength in her ankles. We're gonna wash our hands. Any questions or concerns that you've had? Any difficulty while performing these active range of motion exercises? No. Excellent. That concludes our assessment. We are going to report your findings to your healthcare provider.
Thank you.
Thank you.